Well, I knew there was problems because I had had surgery before. And I do like to read as much as I can about helpful things we can do for our health. And in the meantime, I was aware that my teeth would affect my heart because I was going to a doctor who said, you have inflammation in your body with blood work that he did. So I'm thinking, well, I had better get something done about myself as soon as I can. And so I just kind of prayerfully thought, what can I do? What can I do? You know, because I'm thinking, there's somebody out there somewhere that can help me. I really believe it. Kelly answered the telephone. I don't know if that was Kelly or not. Whoever answered the telephone was so nice and so helpful. So I just felt like, oh, I've got courage now to follow through with this. So that's where I went from there. Oh, when I realized I had more problems, reoccurring problems, I was quite concerned because I guess you could say my greatest fear of my whole dental experience has been that I'm going to lose teeth. I work in the public and I hear stories from people about their problems with their teeth, and I've seen a lot of people have their teeth pulled and have all their teeth pulled and go for false teeth, and I thought, oh man, if there's any way I can ever avoid that, I certainly will do it. So I've been very conscientious about all this. And the beautiful thing is that every time I'd tell someone, don't get your teeth all pulled, and they wouldn't listen to me, and here I am, I'm just, a friend. I would just say that, like, oh, don't do that, And they'd come back and they'd say, oh, you were so right. Why didn't I listen? And then sometimes I'd think, well, I would like to say this to you, but I wouldn't really feel like I should give that input. So I'm just so grateful that Dr. Skinner is able to do this. And I have given a lot of thought to this, having experienced the technology that's available, because I like to watch Dr. Oz on TV and all these people that are giving us information that we can be aggressive about our own health. And my medical doctor says, it's up to you to take care of yourself. I can help you, but it's up to you to make this decision, to be aggressive about managing yourself. And having all those words planted into my mind, I thought, I have got to do something. So when Dr. Skinner showed up there and we could see that he had the technology, and I had the confidence in, after calling, that they could deliver on the opportunity for me to save my teeth. Okay, the first time I met Dr. Skinner, he was very direct with information that I wanted. Very polite, very nice, but very reassuring. Having the information that he laid out there very clearly for me, Dr. Skinner explained it so well that I had no question in my mind that I would get the procedure and I would be successful. I just thought, well, I've made it. Hallelujah. One more close call with these teeth. See these teeth? I made it. I survived nicely. I mean, I didn't suffer. That's the part I love. Dr. Skinner explained that the procedure I had the first time was the invasive approach, that laser is not invasive, and that I would not be in pain, that I would not go out here with a mouthful of stuff that I had the first time. He explained that my recovery time would be faster. He explained, Dr. Skinner explained that the way laser works is that you regenerate bone and you regenerate healthy cells in your gums. So that just always music to my ears, because I thought, oh, Dr. Skinner, you have got this down. And, of course, now I have to tell everyone I know that Dr. Skinner can do this for you. And I have a friend that I'm just begging her to let me bring her, because she said, Susie, I've already lost a lot of teeth and I'm going to lose them all. And I said, no, you do not have to. And I'm telling you, you do not have to lose your teeth. So there you go. Periolase is so not invasive that I can't even tell you that, after 3 days, I wasn't even thinking about having had the surgery, nor did I limit. I was very careful to do the things that I was told to do, but it just was not the rough procedure that I had had before. Well, there are a lot of people like in talk radio now who are talking about inflammation in the body can affect the heart. Anywhere in the body can affect the heart. I've had blood work done that showed that my family history of heart problems was coming my way. I had no clue because I feel like I'm a very healthy person. I'm a very active person. I'm 65. I still work 30-hour week as well as maintain my home.
Before dental implants, the choices for a patient that had no teeth were pretty limited. A denture, which really hadn't changed much since George Washington, had dentures made out of elk teeth and rubber. Even the best denture, you only chew with about 30% of your normal chewing function. The patient loses sense of taste, smell, and it greatly affects their confidence and self-esteem. I think if you have teeth, you really can't appreciate how bad dentures are. You know, there's a whole industry built on adhesives and whole advertising campaign based on the embarrassment and inconvenience of having dentures. In many cases, a person with dentures, we can replace their teeth with no stitches, no incisions. We have an in-office CAT scan which allows us to very precisely plan the implant placement and the replacement of their teeth. Most people that we provide their tooth replacement are amazed at the level of the technology, that they're able to come in and have permanent teeth that don't come in and out. Many of them say it feels just like they had their natural teeth. When we're replacing a person's denture, the first thing we do is a very detailed examination and diagnostic setup of their replacement teeth in wax. Then from that, we make a radiographic guide, which the patient wears for our CAT scan. That guide information then goes to Sweden, where they make a surgical guide that fits in the patient's mouth. We're then able to place the implants through the surgery guide just by punching a little hole in the tissue without any stitches or any incisions. Yeah, I mean, patients are amazed at how it changes their appearance and how they feel like they're the person they used to be before they had dentures. You know, a lot of people that we do the tooth replacement on have had dentures for 20, 30, 40 years and have really forgotten what it's like to have fixed teeth. So for those people, you know, it's huge. Yeah, there is a big sense of accomplishment in being able to provide people with a service that restores a big part of their life that they've been missing, that enhances their self-esteem, their enjoyment of food, their confidence. Well, as opposed to most people that place implants using an X-ray, which is two-dimensional, we have a CAT scan, which is three-dimensional. And what it does, it allows us to much more precisely plan the implant procedure. It makes the procedure much less invasive, minimal tissue reflection, much less trauma to the patient. We know in advance whether or not we're going to have to do any bone grafting, anything like that. Right, the CAT scan gives a big edge in precision with the implant placement. For many people, we can place the implants, replace the teeth with no stitches, no incision, which means less pain, less recovery time. People are back to their normal lives more quickly. Well, the CAT scan allows me to place implants much more precisely than I can with a two-dimensional X-ray, and in many cases that means minimizing the procedure for the patient. If a person has dentures, with the technology that's available today, they can plan on throwing those away. Well, you don't have to be missing all your teeth to benefit from dental implants. Even people that are missing one tooth, have a bridge or have a partial, we can still use the CAT scan technology to place those implants and replace teeth. The advantage of the implant over a bridge is you don't have to cut down teeth to replace a missing tooth. And many times placement of one or two implants, a patient can get rid of a partial, which is basically almost like a denture. Well, the advantage of an implant over a bridge is you don't have to cut down the adjacent teeth to replace the missing tooth. And many teeth associated with bridges end up having problems in the future due to decay and additional stress on the teeth. The implant's self-supporting. It takes stress off the other teeth. And some things don't happen to implants. You don't get decay and you don't need root canals. So implants are very predictable with a 95% long-term, 15, 20-year success rate. Now, dentures are a very antiquated solution to lost teeth. Even the best denture, the patient only chews with about 30% of their normal chewing function. They lose a lot of their sense of taste, sensation of chewing food, and greatly affects their confidence and self-esteem. Now with implants, people can have fixed teeth. They no longer have to have dentures. Well, implants are anchors that are placed to help secure the teeth. And as opposed to dentures that require just on mechanical adhesion or suction, the implants are actually anchored to the patient. So many people say they feel as though they have their natural teeth. Now, a lot of times people are very excited. They look, literally 20 years younger, and it's because the implants supply anchorage that allows us to place the teeth where they need to be for cosmetics and function, as opposed to their old denture. Now, dentures are a very antiquated solution to lost teeth. Even the best denture, the patient only chews with about 30% of their normal chewing function. They lose a lot of their sense of taste, sensation of chewing food, and greatly affects their confidence and self-esteem. Now with implants, people can have fixed teeth. They no longer have to have dentures. Well, implants are anchors that are placed to help secure the teeth. And as opposed to dentures that require just on mechanical adhesion or suction, the implants are actually anchored to the patient. So many people say they feel as though they have their natural teeth. Yeah, a lot of times people are very excited. They look, literally 20 years younger, and it's because the implants supply anchorage that allows us to place the teeth where they need to be for cosmetics and function, as opposed to their old denture. Well, the CAT scan's a big advantage in that it gives us a three-dimensional picture of the patient as opposed to a normal two-dimensional X-ray.
Well, Charlie, it's totally revolutionized the way dental implants are done. We use a CAT scan to generate a virtual model of the patient. Then we can put that into a computer and do surgery on the computer, placement of the implants on the computer before we see the patient. This allows us to place the implants with much more precision than previously possible and much less invasive procedure for the patient.
Is this something that anyone who does dental implants can implement, this kind of procedure?
Well, they could, Charlie, but most people, even though they might have placed many implants, have little or no experience with this type of technology, and it's something we do in the office routinely.
Gotcha. Let's talk about the CAT scan. You mentioned that. Is that very expensive?
We don't charge any more for the CAT scan than most dentists charge for a regular X-ray. The CAT scan takes about 10 seconds. You set in it just as you would a dental X-ray machine. Has about 85% less radiation than normal dental X-rays. Many times we're able to diagnose problems that couldn't otherwise be seen without the CAT scan. I think there's a big misconception about the cost of dental implants. Replacing a tooth with a dental implant is no more expensive than replacing a tooth with a bridge.
Really?
A bridge involves cutting down the adjacent teeth, so many times there's additional cost involved with those teeth later. So placing the implant, if you have the opportunity, is definitely the best choice.
Good enough. Right now, let's hear what some of Dr. Skinner's patients have to say about the implant process. Hello, I'm Charlie Chase, and I'm here to tell you about some exciting news, something you can do to reduce your risk of heart attack, stroke, diabetes, and even some forms of cancer. And it's not what you think. It's about keeping your mouth healthy. And the best news yet is that now there's an easy way to do it. It's a proven fact that the health of your mouth can have a huge impact on the health of your entire body. Today, we'll visit with a couple of experts, Dr. Michael Skinner, a specialist in the treatment of gum disease, and Dr. Mark Houston, a specialist in internal medicine and hypertension. And if you're already missing your teeth, don't you go away, because now you can throw your dentures away and have a full set of teeth that you can't take out. And what's amazing about that is you can get them without any incisions or stitches. Yes, you heard me right. But we'll get to that in just a little while. For now, let's talk a little bit about how to keep those teeth and keep your body healthy as well. Now, I know most of you have heard of dental implants, but did you know they can now be placed with the use of advanced computer imaging, many times with no stitches and no incisions? Many people can come in one day with dentures or partials or just a missing tooth and leave with teeth you can't go home and take out. Dr. Michael Skinner is a national leader in the field of CAT scan guided implant placement, and he's right here in Nashville, Tennessee. Call today for your appointment, 370-9486, the Advanced Institute for Oral Health. To make your appointment, call 370-9486 or on the web, www.newteethforme.com. If you would like to replace missing teeth with no incision, no stitches, and little or no pain, contact the Advanced Institute for Oral Health at 370-9486 and online, newteethforme.com.
For people who've avoided gum treatment because they were frightened or afraid, they don't have to be afraid anymore. We offer sedation. It just gives patients the peace of mind to know that they're not going to be uncomfortable during the procedure. A lot of people have avoided dental treatment in the past because they were anxious about the discomfort associated with it, and just eliminates that concern for them. We offer IV sedation for patients. Many patients have avoided treatment in the past because they were fearful of the dentist, and sedation just gives them the peace of mind to know they're going to be able to come in and not be uncomfortable. We offer sedation. It just gives patients the peace of mind to know that they're not going to be uncomfortable during the procedure. A lot of people have avoided dental treatment in the past because they were anxious about the discomfort associated with it, and just eliminates that concern for them. We offer IV sedation for patients. Many patients have avoided treatment in the past because they were fearful of the dentist, and sedation just gives them the peace of mind to know they're going to be able to come in and not be uncomfortable.